Understanding Medical Terminology, an easy-to-follow guide for aspiring healthcare students and patients alike. For the average person, and even students in a healthcare program, medical terminology sounds like a different language. That's because it is. Many medical terms are based on the ancient languages of Latin and Greek, where the practice of medicine originated and advanced. Just like most complex words in the English language, many medical terms are made by combining a root word with a prefix and/or a suffix. The root word may also be called the base word and gives information about a specific body system or process. Sometimes a root word may be used as a prefix, which comes at the beginning of the word. Prefixes can tell us directional or positional information or quantify something. On the other hand, a suffix comes at the end of a word and provides more information about our root word and may even change its part of speech. Because the root word is the foundation of our medical term that we build upon, we'll begin by taking a closer look at what they are. Root words tell us what body system we are talking about. For instance, the root cardi or cardio refers to the heart, whereas vascular refers to the arteries and veins. You'll notice that sometimes root words, especially those ending in an I, may be followed by an O, but not always. Cardio can be combined with vascular to form cardiovascular in reference to the heart and all of its associated vessels and structures. If we're discussing arteries, we may see the root words artery or arterio, angi or angio, aort or ather or athero. When discussing the other vessels of the vascular system, the veins, we may use ven or veno, or phleb or phlebo as our root word. The majority of the time, root words make little sense without a suffix added to the end to give us more information about the root word. In medicine, the addition of a suffix can indicate a condition, a focus, a procedure, or size, just to name a few. It can also make the root word singular or plural. Let's take the word arthur, which refers to our joints. If we add the suffix osis, meaning a condition, we form the word arthrosis, which is a general condition of the joints. Using the same root word, we can change the suffix to itis, which means inflammation, and it gives us a new word, arthritis, or inflammation of the joints, which is a specific type of condition. Other suffixes like ia, ism, and pathy also indicate conditions of a specific system. An arrhythmia is an abnormal heartbeat, and hyperlipidemia is high cholesterol. Embolism is a foreign body in the bloodstream that creates a blockage of arteries or veins, usually a clot. Cardiomyopathy and neuropathy are conditions of the heart and nervous system, respectively. We can also use suffixes to indicate a focus on a particular topic, like ology or ologist. Combined with the root word cardi, we form the words cardiology and cardiologist, the study of the heart and those who study it. The suffixes "eri", "ac", and "ium", as well as "all", also create a word associated with a focus like pulmonary, which refers to the lungs, or coronary, referring to the arteries of the heart, cardiac or cardium, also referring to the heart, and congenital, meaning present at birth. Suffixes like otomy or ectomy indicate a procedure that penetrates the skin, like phlebotomy, which means drawing blood with a needle, or remove something like a phlebectomy, which is surgical removal of a vein. An appendectomy and a tonsillectomy are probably the most familiar medical terms that end with the suffix ectomy. The words echocardiogram and electrocardiograph are procedures to evaluate the heart indicated by the suffixes gram and graph. Both also contain a prefix, which we will cover shortly. Suffixes can also tell us the size of something. An arterial ends in the suffix ol, meaning very small. Because we know the root word artery refers to the arteries, we can determine that an arteriole is a very small artery. The same is true of the suffix "ule." When you combine it with the root word for vein, we get the medical term for a very small vein, or a venule. The opposite suffix of being small is megaly. Therefore, the term cardiomegaly refers to an enlarged heart. Besides changing the size of our root word with a suffix, we can also make them singular or plural. One bacterium, but many bacteria. The suffix "ium" is singular while "ia" is plural. We can do the same with the root word atr, referring to the top two chambers of the heart. One atrium, but two atria. The suffixes "us" and "I" also change our root word from singular to plural. One thrombus, which is a blood clot, or several thrombi. Similarly, one embolus with several emboli. Oftentimes, especially in such a precise language like medical terminology, a root word and suffix just is not sufficient, so we need to add more descriptors in the form of a prefix at the beginning to further change the meaning of the root word. Many times it's necessary to indicate a direction or a position on the body, like inside, outside, middle, high, low, within, or above. We use the prefixes endo, peri, and myo to locate something inside, outside, or in the middle of a structure like the inside of the heart, which we call the endocardium. The outside is the pericardium, and the middle between these two is the myocardium. Myo can also mean muscle, which the myocardium is a thick muscle layer of the heart tissue, while the pericardium is a membranous sac, and the endocardium is the lining of the heart chambers, which we also call the atrium and ventricles. As we already noted, prefixes can also quantify or provide us with numerical or other information like color about our root word. We can add the prefix uni to mean one, bi for two, tri for three, and tetra for four. If we want to indicate a portion of our root word, we can use semi, which means partial, or hemi, meaning half or one-sided. To describe an abnormal heart rate or breathing rate, we can use the prefixes tachy, which means fast, or brady, which means slow, as in tachycardia or bradycardia to describe a heart rate, and tachypnea and bradyapnea to refer to respiratory rate. The color of our root word can be detailed with use of the prefix erythro, which denotes red, leuco for white, and cyano for blue. Examples include erythrocytes for red blood cells and leukocytes for white blood cells. Cyanosis is the state of being blue in color, especially of the skin, nails, and lips. Prefixes can also be used to make antonyms or opposites from our root words by transforming it to a negative meaning. This can be accomplished with the use of ab or dis to mean bad, as in abnormal, ablation, dysfunction, or dyspnea, which is difficulty breathing. If we want to transform our root word to mean without something, we can add an or a, as in anaerobic, which means without oxygen, asystole, without a heartbeat, or apnea, without breathing. The prefixes anti and d mean against our root word. Anticoagulant means against coagulation, which is clotting, and defibrillation means against fibrillation, which is an abnormal heartbeat that's incompatible with life. By understanding how we build medical terms with root words, suffixes, and prefixes, we can easily break the terms down to identify the particular body system or process it involves, whether it's a condition, focus, procedure, or a specific size, and what direction, quantity, or color the word refers to. This would help us translate to common everyday English that is easy to understand, so we're better informed about medical decisions.